They are just showing us some of the equipment and diagnostic machines that are available in the country. And just that was there at the Kenyatta University Teaching, Research and Referral Hospital. But here in the studio, I have with me caregivers who have joined us to talk about management, which is one of the key critical areas of cancer care. And the caregivers that I have, we have Jacqueline Nyongesa of Kimbilio Hospice. She's a clinical officer. We have Elsie Gaitugi, a palliative care nurse at the Nairobi Hospital. And then we also have Dr. Zipporah Ali, who is also the retired but founding member of Kenya Hospices and Palliative Care Association. I welcome you all into the studio. And this, just as we go into this discussion, and we've talked about diagnosis, is this the part where the patients come to you and this is where your work starts? I'll start with you, Dr. Zipporah.
Well, ideally, this should be the part where the patient is also referred to the palliative care team, or the palliative care team is made part of the team that's taking care of the patient. Unfortunately, this does not really happen. Most times, patients are sent to the palliative care team when their disease is quite advanced. And others, ideally, a patient should be able to receive palliative care from the time they have a diagnosis of cancer. And let me just clarify, palliative care is not just for cancer, it also cuts across other serious illnesses or life-threatening illnesses. So if a patient has had a diagnosis of a cancer, there are so many things that this patient will be needing. For example, they might need symptom management, and you heard the doctors talk about the fact that it might be the pain that is bringing the patient to the doctor. And that pain, the cancer pain, is usually very, very, it's really severe and needs specific or special medications. And that's where the palliative care team comes in to be able to provide pain management, but not just pain management, but also many other symptoms that come with cancer. But apart from that, palliative care is really holistic. It focuses on the person. It's person-centered. It focuses on the family. So we look at the patient's physical needs. We also look at the psychological needs, the social needs, the emotional needs, the spiritual needs, and even, as my two colleagues will tell you later on, at the financial needs, because most of the palliative care providers in this country give a very subsidized, very low-cost treatment or services to their patients. So palliative care should actually ideally start from the time of diagnosis, and patients should not be afraid to come to a palliative care center, because we manage their symptoms. We have them also, once we manage their symptoms and counsel them and counsel the family, they're able to actually focus on their treatment. So it goes it goes hand in hand with the treatment. So we actually are able to provide them with that comfort that they need. And even after the treatment is over, it continues, because it provides, it helps them understand the side effects of the long-term side effects of their disease, or it provides supportive treatment for the patient. So it's really a continuous kind of treatment from the time of diagnosis throughout the illness. And if a patient is very sick, and people do get very sick, and sometimes they might be dying, then we also, of course, provide end-of-life care and bereavement services to the patient's family and loved ones. So it's really a very comprehensive service and should be part of a comprehensive cancer care center, which is an element that we look at into much later. But now with you, Elsie, as a palliative care nurse, and you've talked about patients being referred. Are there families who just bring in their patients to you?
Thank you for that question, Jael. Yes, we do have patients who are referred even from their family members. Our hope is that every consulting oncology would refer a patient as early, immediately after the diagnosis. Unfortunately, it doesn't happen, but due to the symptoms that are related to the disease, sometimes they are very distressing. Like, for example, patient is screaming in pain the whole night. Of course, due to that pain, the family won't sleep. The relatives will be forced to look for a place where they can get help. And that way we come in. The relatives, maybe the patient, even you have patient referring the other patients. Like, they'll just tell the patient, I had a place where my pain was controlled. So they end up knowing there is a hospice where they can get the symptom control.
And maybe Jacqueline, as people running Kimbilio Hospice, when somebody comes to you, when a patient comes to you, this is a newly diagnosed person with cancer, how does the care look like? Where do you start from? And do you also involve the family in this?
Yes, asante sana Jael. Majina yangu ni Jacqueline Nyongesa, kwa clinical officer with a specialty in palliative and hospice. Kwanza Kimbilio Hospice iko katika kaunti ya Uasin Gishu na kaunti ndogo ya Tarbo, ambayo tunafanya kazi ya palliative. Mgonjwa anapokuja kwetu mahali pale tunamshughulikia kikamilifu Kuna idara tofauti ambao wanaweza kushughulikia mgonjwa. Tunafanya kazi pamoja na social workers ambao pia ni watu muhimu sana. Kuna pia chaplains ambayo pia anashughulikia maslahi ya kiroho ya wagonjwa wetu. Kuna pia counselors. Maana wagonjwa wanakuja mahali pale wakiwa wamesumbuliwa na mawazo. Kwa hivyo tuna incorporate hawa watu wote pia. Tuko pia na clinicians ambao ni nurses na clinical officers ambao wanashughulikia pia maslahi ya physical pain ya wagonjwa wetu. Wanapokuja mahali pale mgonjwa hawi peke yake. Anashughulikiwa kikamilifu katika sehemu mbalimbali na idara zote. Na Kimbilio Hospice inapofanya mahali pale tunaongozwa na mission. Mission yetu ambayo ni creating a community of compassion that honors life and offers hope. Tunapatia wagonjwa matumaini wakiwa mahali pale. Wagonjwa wanakuja wakiwa wamepoteza matumaini, wakija kwetu tunawapatia matumaini. Tuko pia na timu ambayo ni nguvu sana, nafanya nao kazi pamoja, ni caregivers. Hao ndio wanashughulikia wagonjwa, kuwaosha, kuwalisha, kuwatoa nje waweze kuota jua, ambayo ni jambo ambayo wagonjwa wanajivunia sana. Na vile Kimbilio inavyosema jina is a place of refuge. Watu wanakimbilia mahali pale kupata msaada. Wanapokuja mahali pale sisi hatuwaiti wagonjwa, tunawaita wageni. We call them guests. Kwa sababu ni wageni wamekuja mahali petu kupata msaada. Kwa hivyo Kimbilio wanapokuja mahali pale tunaanzia matibabu na familia. This palliative care inahusu pia wagonjwa pamoja na familia. Hatujaweka wa familia nje kwa sababu ni sehemu, na kila hatua tunayofanya katika matibabu ya wagonjwa tunahusisha familia. Maana ni kiungo muhimu sana kwa ajili ya kutibu wagonjwa. Tena kwa mara nyingine pia kuna timu ambayo inaitwa outreach, ambayo pia tunawatuma kila mahali kwenda kuangalia wagonjwa ambao wanahitaji msaada. Jengo hili liliweka mahali pale kwa sababu kulikuwa na pengo mahali. Kulikuwa na pengo ambayo watu wakitoka hospitali pengine ako katika hatua aina ya kansa, anashindwa aende wapi. Hapo ndio Kimbilio iliweza kuingilia, kuweza kuendeleza, kupatia watu tumaini na kuongezea hata udhamana katika maisha yao.
Asante Jacqueline. Nirudi kwako Dr. Zipporah. Just talking about helping family in caregiving, because a lot of the times I think a huge percentage are caregivers at home and not specialists done in the hospices or hospitals like you. So how do family members, how are they helped to transition into caregiving?
Just like she said, that family is very important in palliative care. In fact, we talk about the unit of care being the family and the patient, and the team that takes care of the patient includes the family. Mostly when the patients come to, like, for example, Kimbilio Hospice or Nairobi Hospice or other hospices or the palliative care units in the public hospitals, the team there will actually talk with the patient's family and teach them about what they need to do for the patient. For example, how the patient is going to take their medication, and if the patient has a wound, sometimes it's not possible for the team to go out there and dress the wound on a daily basis. So they teach the family members how to dress a wound. They teach them about nutrition, what the patient should be able to eat. Sometimes you find that when a patient is very sick, family members just put a big piece of ugali and a big chunk of meat on the then of course the patient doesn't have that kind of appetite, maybe when they've just had their chemotherapy. So they also teach the family members on nutrition, what the patient should eat, and what, how they should actually even display the food and feed the patient. So there's a lot that goes on. Counseling, as you know, family members also become very affected when their patient is sick. This is a patient, somebody that you love, you've been told they've got cancer. Sometimes you're told they're at an advanced stage. Sometimes you're told they're at end of life care. So you go as a family member and a caretaker, you go through a lot of emotional issues, spiritual issues, but also financial, because sometimes you leave your job to take care of your loved one. So you also have no finances in the home. So family caregivers really need a lot of support. I mean, we should actually invest as healthcare professionals, not just as healthcare professionals, but even our own government should invest in supporting family caregivers, because they are actually offloading most of the work from the healthcare workers and from the government. So they are very important.
Thank you, Dr. Zipporah Ali. And here we are speaking with the caregivers, just looking at the issues of caregiving, both at the hospices, professional level, and also at the family level, where the family members also take up the role as caregivers at home for the cancer warriors. Right now, I'll just hand it back to Trevor studio, where we have most of our cancer warriors.
Naam, shukran sana.